Hey guys, it's Jeanette. This is a little different. I am heading to the gym, but I did not want to go without making a video today. And I don't think I'll be able to make one when I get home, so I have maybe 2 minutes of driving. It'll be a quick video. I did my first simulation for MedSurg. It was working and treating a patient that had diabetic ketoacidosis, and then a sickle cell patient that had a crisis. So man, and then so we actually we do these different stations, and we had the diabetes like simulation first, and that was kind of good because if it was less, I guess it was more flexible, and it was one teacher observing two groups, and she was going in and out and talking on behalf of the patient. And then like for us, we actually draw roles. So there's like primary nurse, medication nurse, student nurse, observer, and family member. So obviously you're like, you're always dreading drawing because you don't know. If you're more comfortable explaining medications, you would want the medication role, but then again, you never know, so you have to kind of prepare for all of the different roles. I felt like I could probably handle primary because most of my studying had to do with just both of the diseases, and I stressed on education. So I was okay and ready to be that person. I was not ready to be the medication nurse because I don't know what it is about me and my brain. Sometimes I just blank out when it has to do with medicine and just thinking about side effects and all this stuff. So that's something I'm still working on. But luckily for the first one, they kind of let us choose roles for the diabetes simulation. And I still, happily volunteered for the primary care nurse. And we kind of split the tasks. So I had my student nurse starting assessing and taking vitals while I addressed the patient's initial questions and stuff like that. So that worked out. The teamwork, I cannot stress that. If you can talk and prepare beforehand, talk about what can we delegate, what can we not delegate, the time frame of when you want to get vitals for this person, make sure if if there's any pain to address, that you do that as soon as possible. So that went pretty well. We had really good feedback, and now that we went through that diabetes simulation, the tougher simulation, the sickle cell simulation, just felt like we learned a lot from that first experience in the day, that we learned something that we could use during our sickle cell presentation or simulation, whatever. So after that, my nerves were kind of stabilized, until the next simulation. So then when we're preparing for that sickle cell, we get to the room, and this is the mannequin that actually is able to respond. You can hear lung sounds, you ask questions, and they'll be kind of talking to you. So patient interaction and communication is key. So obviously we're going there, and there has to be a teacher that's prompting it, and it's behind the two-way mirror. And it happens to be like our director of nursing, like the entire program. My heart rate just skyrocketed, and she actually is a wonderful lady, and I have some type of relationship with her because of my nursing student organization that I'm a class representative for. So I was like, great, I was happy that I felt comfortable, semi-comfortable with her, but then I was also very anxious because this is like the dean or director of the entire nursing program, so I had to have my stuff together. So we went in, and obviously we do the whole drawing thing, and guess who gets primary nurse? Me. And I'm like, okay, well, what did I do in the diabetes that I could kind of do in the sickle cell? So I went with that. So now that I finished the diabetes simulation, and I pulled the primary nurse card for the sickle cell, I started reflecting back on what I did that I could have done better in the first simulation. I went and thought about what the teacher gave us for feedback, and then I reviewed my cheat sheet that had kind of you know, the orders that we should be doing, the medication that he'll be getting, and kind of just background information, so if the patient were to ask me questions, I would be ready to respond. So it went really well. Like, the prompter, you know, like the dean or director, who would call her, she was really impressed in what we did. We hit really great, like, high points and everything, and the stuff that she asked, we actually did. And she also asked me or the team, and I volunteered to teach her how to use the spermometer, and I taught it to my best of my ability, but I did learn of the real reason why we do it, and so it's just a really good learning experience. And I wish that, like, after this really high stressful day, I wish that I just calmed myself down, thought about, okay, this is a patient, all the lab values, all of the chart stuff, yes, have a good understanding of it, but that shouldn't really be my high concern. You know, I want to make sure that I have good rapport with the patient, that I'm, you know, communicating well, and I'm asking all the right questions, that I'm making sure that they're comfortable, that I'm addressing the patient and not really stress so much about the paperwork or the chart and stuff like that. So overall, it went pretty well. I am still waiting for our grades to be posted. I think we did fairly well. After the entire simulation, we had to do like a docu-care and kind of document everything, and I think our documentation was pretty good, but the teachers did, like, stress, like, you know, have fun with it. This is a learning experience. This is the best time to make a mistake because no one will die. And they're like, oh, if the patient dies, it's okay, you know, just document what you should have done, or you know, whatever you learned. I'm like, I kind of don't want my mannequin to die. So yeah, anyways, that was that. I'm about to go to Zumba. So I hope you guys are doing well. Happy Tuesday / Wednesday, depending on when this video will upload. So yeah, simulation was good. I'm just so happy that's over with. Now that that's over with, I have exactly, what, a week to prepare for exam 1. So my first exam is on diabetes, chronic illness, hematology, GI, and GU. Yeah, and so that's a lot of information. I'm doing concept maps for this first exam. I'm really hoping that it gives me a good understanding of the big picture, and that it kind of guides me on zoning into the different diseases and, you know, systems or whatever. So I'm just looking forward to keep moving. And like I said, there's, I think, like a month in between exam 1 and exam 2. I just really hope that with all the preparation that I do well, that I'm not like, that I don't fail, because that's a lot of stress to take for like that 1 month, because, you know, exam 2 can kind of really tell you whether you still have a chance or kind of not, you know. It all plays down to points. But that's it. If you have any questions, leave it in the comments below. If you have a simulation, how did it go? If you have one coming up, what's it on? Do you know? If you have any questions on how to prepare, let me know. What else? I think that's it. Again, comment below if you have any questions. Yeah, that's it. Don't forget to comment, like, and subscribe, and share the videos. And until next time, bye.